Most of the patients that I see are of low income and low health literacy. And I think that predominant feelings about research for these patients are negative because they are concerned that they may be manipulated to be involved in a study that might do them harm, and that it's for the greater good for someone else, but not relating to themselves. I have had some patients with some serious diseases in the past who've been asked to participate in studies, and they talk about it with their families, and most of the time they choose not to participate. However, from a clinical perspective, when I talk to patients about, for example, the risk for a heart attack using the Framingham risk score, I'll explain to them how the studies have been going on for 50 years. They've used many thousands and thousands of people. So that perspective, where they're not individually involved, I think they're more respectful of that. I'm not sure that they always understand that the populations that are studied may really be related to them or not to them. So, for example, I don't think as many studies about Hispanic patients with lupus have been done, but and we don't usually discuss that because I think that would be difficult. It's more it'd be a little bit hard regarding the amount of understanding. We try to use very basic principles to help them absorb the information. But on the other hand, I think if presented in a way that that they can see, they can judge for themselves and have a choice in terms of the information, if it can be presented in a really simple way, I think they are more open to listening to it, especially if it's done in a repeated manner. But I'd say the general feeling is probably more negative than positive.